Hello everyone, you're watching sqadia.com and we are going through the atraumatic causes of osteonecrosis of the bone. And one of those metabolic causes include Gaucher's disease, which is basically a lysosomal enzymatic deficiency, and one of the another cause is radiation necrosis. This radiation necrosis is not common, but especially in those patients which have undergone tumor surgery, is either neoadjuvant radiotherapy or adjuvant radiotherapy are usually given, and there's always a chance that post radiotherapy they either may eventually result in osteonecrosis of the that amount of bone which is actually exposed to radiation. We'll be going through the clinical features of Gaucher's disease, its pathology, and briefly imaging and treatment. We'll also be going through the treatment and pathology of the radiation necrosis. So, what is Gaucher's disease? It's actually a lysosomal disorder. But there's inherited deficiency of lysosomal enzymes called as glucocerebrosidase, characterized by accumulation of glycoceramide in the lysosomes of reticuloendothelial cells, producing Gaucher cells. What actually happens is that this glucocerebrosidase is absent, so they actually glucosylceramide is not degraded and eventually lead to large accumulation of this inside the lysosomes. Eventually these lysosomes get accumulated in the cytoplasm of these cells. The cytoplasm enlarges, leading to large reticuloendothelial cells of larger size, making them Gaucher cells. Usually it's inherited disease and children are affected. There's different degree. There's called as adult type, in which they usually survive till adult age, and there is a juvenile type which is slightly more aggressive but they at least survive. Then there's infantile type which is so lethal that the child cannot survive beyond 3 years. But if the child does survive, usually what are the signs symptoms which actually they appear with, as there's actually enzymatic lack of certain enzymes in the cell, so the whole metabolism is actually affected. Hip is most frequently affected. Lesions also appear in the distal femur, talus, and head of the humerus. Bone ischemia actually leads to increase in the medullary cell volume and sinusoidal compression. So these are some of the causes. They usually present with growth retardation. There's almost as 40% of the cases they present with anemia, moderate to severe hepatomegaly. There's always hepatosplenomegaly or associates massive splenomegaly as well, and moderate to severe thrombocytopenia. Now, the problem is with erythropoiesis. If in children, usually the liver, the spleen, and the long bones are actually involved in hematopoietic erythropoiesis, and those tissues which actually producing the blood cells such as RBCs, platelets, WBCs, and all that. So, if that is actually defected, this would result in anemia because the RBC production is not enough. There is definitely severe infections leading to decreased amount of WBCs, and there will be problems with the blood coagulation as well because there is definitely a small amount of there's associated thrombocytopenia as well. So all this actually leads to bone pain, bone crisis, and sometimes there is the radiological evidence. Sometimes the bone appears absolutely normal, but actually there is infarction and ischemia and bone necrosis is actually going on in these children. It's a familial metabolic disorder, as we already know. And this is a classical presentation, as if you can see where sometimes it looks like this could be simply sickle cell disease, this could be Gaucher's disease, this could be even osteomyelitis. But we need to confirm it out because there will be always be sclerotic changes in the bone. Now this is distal tibia showing this amount of the bone has actually necrosed. This is the head showing this degree of sclerosis leading to changes in the bone density. If you see it over here, definitely this is the area which probably had an old fracture, and now this area is actually necrosed as well. There is definitely some degree of sclerosis in the femur as well. So what's the treatment? Treatment is actually, some say that yes, in some time you can replace the missing enzymes, but although it's not a very effective way of treating them. And the other way out is just manage the complications, that is osteonecrosis. Usually if, for example, knee joint has actually osteonecrosed, then we can go for knee joint replacement. And if the femoral head has got necrosis, we can go for femoral head replacement. But usually these children, if they are adolescent or if they're in adult age, then probably surgery is kind of an indicated for adult age only. Usually for an infantile child, the disease is always so severe that they usually expire before 3 to 4 years of age. But in case if they do survive up till adult age, then we can manage mainly the complication. For example, if bone has necrosed, we can lead to that kind of surgery which can help to at least gain enough function so that the child can at least able to walk on or carry out some daily activities of normal life. For adults, the total joint replacement is probably preferable, but that is like managing complications. If the hip has necrosed, you can go for total hip replacement. Knee has necrosed, you can go total knee replacements. Similarly, other joints replacements can also be performed, but they are kind of a last resort because we are just managing complication at this stage. Coming to the radiation necrosis, ionizing radiation, intense or prolonged, causes bone death due to combined effects of damage to small blood vessels, marrow cells, and bone cells. So what actually happens is that when we are giving radiation secondary to, for example, if there was a tumor which was inoperable, or we cannot take the tumor out, for example, in somewhere in the sacrum or the pelvis area, so the radiation is probably the only choice of treatment. What if the radiation is actually given to that area for the treatment of the tumor? The radiation not only kills the tumor cells but also kills the normal cells, and this will actually results in there will be a lot of necrosis due to coagulation of arteries. There will definitely free radical production in the cells which would further lead to cell death, and eventually normal cells will also be killed. So this is what happens in, if you see in the histology of it, marrow and bone cells die and there is no structural bone intact. This is a normal bone and this is after radiation. Gradually, the stress fractures appear and widespread bone destruction occurs. Striking feature is absence of repair and remodeling. Because if there is a fracture, the normal cells would always be there and they will try to cover and cover the area which has fractured. But for example, if the normal cells are also dead, there will definitely no signs of repair and remodeling seen in the radiation necrosis. Surrounding bone is osteoporotic, especially in jaw. Infection may follow tooth extraction. What happens is the bone may be so osteoporotic that they can break easily, or for if the patient has undergone some kind of a dental treatment, this may lead to osteomyelitis and widespread disease because already the bone was susceptible more due to radiation, and now further minor insult has resulted in a catastrophe of the bone. What are the clinical features? Pain, which is usually around the shoulder, hip, sacrum, or pubic symphysis. No, it depends. Mostly it's around the pelvis area because these are the tumors which are around in and around the pelvic and sacrum area that are usually inoperable because of the difficult anatomy and involvement of neurovascular structures around them. So for them, the radiation is always the first choice. That is why most common areas which is usually what happens is that most common area of the pain and radiation necrosis is around the hip and the shoulder joint. History, there will be history of previous treatment by ionizing radiation. There will be local signs of irradiation such as skin pigmentation. Area is usually tender. Movements in the nearby joints are also restricted. General examination may reveal scars and other evidence of original lesion. Now, if you see it over here, this is what has actually happened is that this was the fracture of the acetabulum, which has actually not healed, and probably due to radiation, the whole head has actually collapsed, leading to an osteonecrosis of the femoral head. Now, treatment, it depends upon site of osteonecrosis, quality of the surrounding bone, life expectancy of the patient. Now, if the patient is not going to survive probably for, let's say, a few months, then probably surgery, a surgical option is actually ruled out. But for example, if we know that probably we have cured the disease, and we should give it a maximum chance. For example, if the hip osteonecrosis has occurred, the patient should undergo total hip replacement so that he can have a maximum chance of rehabilitation, walking, as well as he or she would be able to carry out his or her daily activities. Thank you very much. Keep watching sqadia.com.